A test that we commonly employ is known as upper GI endoscopy. That is a test that evaluates the esophagus, stomach, and the first part of the small intestine. We often do that test for evaluation of things such as gastrointestinal bleeding, anemia, abdominal pain, or difficulty swallowing. When we do the test, the patient is sedated, and once they are sedated sufficiently, we will gently pass what we call a gastroscope through the esophagus and into the stomach and evaluate what is going on. With the test, we have the ability to take biopsies or tissue samples and send those to a pathologist to look for any abnormality. We also have the capability with the test to stop any bleeding. We can inject some medicine to make blood vessels shrink and also use something called a heated probe to cauterize any bleeding.
Often we see people who have been previously diagnosed with irritable bowel syndrome. Those people are good candidates to do the breath test to look for something called fructose intolerance, lactose intolerance, and we also check for something called small intestinal bacterial overgrowth. The benefit of doing the breath tests are non-invasive. We do them right in our office, so you don't have to go to a procedure area. And once you're done, you can drive yourself home. We use it primarily to visualize the small intestine. You actually swallow a pill with a camera and it takes pictures as it travels through the small intestine. People wear a little monitor. It actually downloads the picture to the monitor. They swallow it in the morning, they come back in the afternoon. We take the monitor off and we download the pictures on the computer and look at it like it's a movie. People who have the test are usually people that are anemic or having bleeding issues when we can't find a problem on the upper endoscopy or colonoscopy. If we're worried about someone who has Crohn's disease, small bowel cancer, those are the typical people that we do the capsule endoscopy on. If you're a patient that's been diagnosed with Barrett's esophagus, there's a new therapy available in Dubuque that's not available anywhere else in Northeast Iowa, and that's called radiofrequency ablation. And what that involves is applying heat energy to the abnormal tissue in the esophagus to ablate it, to basically burn it off, so that you have regeneration of normal tissue over that area that was previously abnormal. It's an important new technology because it definitely is helping us save lives with regards to preventing esophageal adenocarcinoma, which is an increasing cancer in this society.
Colonoscopy is a very common test nowadays. We can actually look at the walls of the colon, look for growths called polyps, and remove those at the same time. This is a very good way to prevent the development of colon cancer.
It does not hurt to get a colonoscopy. Patients are not awake during the test and are comfortable.
We usually start screening for colorectal cancer at the age of 50. However, let's say their father had colon cancer at the age of 50, was diagnosed then, you would then want to start 10 years prior to that. Colonoscopy can be arranged either through your primary care physician or care provider, or you can oftentimes call our department directly and get an appointment to have a colonoscopy performed.